Picture this. You've been taking your blood thinner every single day exactly as prescribed. You're doing everything right. You go in for your regular checkup, and your doctor looks at your numbers and says, "Your INR is off again. We need to adjust your dose." And this isn't the first time. It keeps happening. The numbers go too high, then too low. Your doctor adjusts, you come back, and it's off again. Here's what most patients, and honestly, even some physicians, don't connect right away. The problem might not be your medication at all. It might be something you ate for breakfast this morning. I'm Dr. Leonid Kim, and welcome back to Senior Health Review, the channel dedicated to health information that's made specifically for adults over 60. Not generic advice, not one-size-fits-all recommendations. Real, age-specific guidance that accounts for how your body actually works at this stage of life. Today we're talking about something I wish every pharmacist reviewed in detail with every patient who walks out with a new blood thinner prescription. Because what I'm about to share with you, most people are never told. We're covering 4 specific foods, 4 things you may be eating regularly right now that can silently interfere with your blood thinner medication and push you toward one of 2 very dangerous outcomes: uncontrolled bleeding or a blood clot. And I need to warn you right now, food number 2 on this list is something the majority of my patients over 60 were eating every single morning, convinced it was one of the healthiest things they could do. Stay with me because that one might genuinely surprise you. Before we get into the foods, let me spend just 2 minutes setting up why this matters so much, and why it matters more after you turn 60. Blood thinners, what doctors call anticoagulants or antiplatelet medications, are prescribed for a very important reason. They reduce your blood's ability to form dangerous clots. If you've been diagnosed with atrial fibrillation, deep vein thrombosis, a pulmonary embolism, or if you've had a stroke or heart valve replacement, these medications are often essential to keeping you alive and healthy. The most common ones I see in patients your age are Warfarin, you might know it as Coumadin, along with newer medications like Eliquis, Xarelto, and Plavix. Now, there are 2 main pathways through which foods can interfere with these medications. I want you to hold on to both of these because they explain every single item on today's list. Pathway number 1 is vitamin K. Warfarin works by blocking vitamin K's role in the clotting process. So when you eat foods very high in vitamin K, you're essentially fighting your own medication. Pathway number 2 is your liver's enzyme system, specifically a family of enzymes called CYP450. Your liver uses these enzymes to break down and clear medications from your body. Certain foods can either block those enzymes, causing drug levels to build up dangerously high, or speed them up, causing your medication to clear too fast and lose its effect. Here's the part that's critical for you specifically. After age 60, liver enzyme activity naturally slows down. This means that when a food disrupts your liver's ability to process medication, that disruption hits harder, and it lasts longer compared to someone who is 35 years old. The same grapefruit that has a minor effect on a younger adult can have a clinically significant effect on you. That's not a scare tactic, that's physiology, and knowing it puts you in control. Alright, let's get into the list. Food number 1, leafy green vegetables. I know what you're thinking. Dr. Kim, you're going to tell me leafy greens are bad for me? No, that's not what I'm saying. Please don't hear this wrong. Leafy greens are genuinely one of the most nutrient-dense food groups you can eat. They support bone health, cognitive function, gut health, and yes, cardiovascular health. I am not here to tell you to stop eating them. What I am here to tell you is this: if you are on warfarin, leafy greens are one of the most common reasons your INR keeps going off the rails, and the reason almost always comes down to one nutrient, vitamin K. Spinach, kale, collard greens, Swiss chard, broccoli, Brussels sprouts. These are all very high in vitamin K1. A single 1 cup serving of cooked spinach contains over 880 micrograms of vitamin K. The daily adequate intake for adults is around 90 to 120 micrograms. So one serving of cooked spinach is nearly 8 times your daily baseline. Now, why does this matter for warfarin specifically? Warfarin works by interfering with vitamin K's role in activating clotting factors in your liver. When you eat a large amount of vitamin K, you're essentially flooding that system and partially overriding what the warfarin is trying to do. Your INR drops. Your doctor sees that your blood is clotting more than it should be. They increase your dose. Then you go 2 weeks eating less greens because you read something online, and now your INR spikes in the opposite direction and your bleeding risk goes up. I want to point out something I see specifically in my older patients that makes this pattern even more common. After a cardiac event, a heart attack, a stroke, a new AFib diagnosis, many people suddenly become very motivated to eat healthier. They start adding spinach to smoothies, eating kale salads for lunch, and that's happening at exactly the same time they've just been started on warfarin. The timing creates this dangerous seesaw effect with their INR. Here's the practical guidance, and this is a nuance that matters. The goal is not to eliminate leafy greens. The goal is consistency. Your doctor calibrates your warfarin dose based on your typical diet. If you eat 1 cup of spinach 3 times a week, your dose should reflect that. The dangerous situation is when your intake swings dramatically. 2 weeks of very high vitamin K, then 2 weeks of almost none. So here's your rule. Decide on a realistic, consistent weekly amount of high vitamin K greens. Stick to it and inform your doctor if that changes significantly. Don't binge on a week of kale salads after watching a health documentary and then cut everything out the week after. If you're on Eliquis, Xarelto, or Plavix, the good news is that these newer medications are much less sensitive to vitamin K. But if you're on warfarin, this is something you need to manage actively and consistently. Food number 2, grapefruit and grapefruit juice. This is the one I promised you, and I want you to think for a moment. Do you drink a glass of grapefruit juice in the morning? A lot of my patients over 60 do. It feels fresh. It feels like a healthy start to the day. It has vitamin C. It's been part of the routine for years. I want you to pay very close attention to this next section because this interaction is one of the most underappreciated drug-food interactions in medicine. Grapefruit contains a group of chemical compounds called furanocoumarins. These compounds have one very specific and very problematic effect on your body. They block a liver enzyme called CYP3A4. CYP3A4 is responsible for metabolizing, breaking down, a huge number of medications. We're talking about 50% or more of all commonly prescribed drugs. And when grapefruit blocks this enzyme, your medication doesn't get cleared from your body at the normal rate. It builds up. Blood levels of the drug climb higher than your doctor intended. For someone on blood thinners, that means the anticoagulant effect becomes stronger than prescribed. Your bleeding risk increases, sometimes significantly. And this isn't a small theoretical risk. This is well documented in clinical literature. The FDA has issued warnings about it. And yet, I still regularly see patients who have never been told. Here is what makes this especially dangerous for you, specifically. As I mentioned earlier, your liver enzyme activity slows after age 60. So your baseline rate of clearing medications is already somewhat reduced compared to when you were younger. When you then add a grapefruit compound that further blocks those enzymes, you're compounding a vulnerability that already exists. The drug buildup is more pronounced and it lasts longer in your system. And here's something important. The effect of grapefruit on CYP3A4 isn't like eating a food and having it wear off in a few hours. Furanocoumarins create an effect that can last 24 to 72 hours. A single glass of grapefruit juice in the morning can still be affecting your medication metabolism the following day. Now, I want to be clear about which blood thinners are most affected. Xarelto has documented interactions with grapefruit. Certain medications commonly taken alongside blood thinners, like atorvastatin and other statins, amlodipine for blood pressure, are also significantly affected by this same enzyme pathway. Warfarin is a bit different. It's metabolized through a different enzyme pathway, but I still recommend patients on warfarin exercise caution because of the overall complexity of the interaction picture. The practical guidance here is simpler than the science. Not cut back, not have a small amount. Avoid it entirely while you're on these medications. And this applies equally to whole grapefruit, grapefruit juice, and any supplement containing grapefruit extract. If you love citrus in the morning, orange juice in moderate amounts does not carry the same enzyme blocking effect. That's a reasonable substitute. Before I move on to number 3, if your doctor or pharmacist has never gone through this list with you, I want to ask you to do one thing right now. Hit the like button on this video and share it with someone you know who is on blood thinners. This kind of information can prevent a serious, potentially life-threatening complication. That's why we're here. Food number 3, garlic and fish oil supplements. Here's a scenario I've seen play out more times than I can count. A patient comes in, they're on Warfarin or Eliquis. Their INR is elevated, higher than it should be. We review their medications, their diet. Everything looks the same. And then I ask, are you taking any supplements? And out comes the list. Fish oil, 3 capsules a day. Garlic extract, because they read it was good for the heart. Maybe some vitamin E on top of that. And right there is the answer. There is a very common misconception, especially among health-conscious adults over 60, that natural supplements are inherently safe to add on top of whatever your doctor has prescribed. And I understand why that feels logical. These aren't drugs, they're natural compounds. But your body doesn't distinguish between natural and pharmaceutical when it comes to how these things interact in your bloodstream. Fish oil, omega-3 fatty acids, has been shown in multiple studies to have antiplatelet properties. That means it inhibits platelets from clumping together to form clots. On its own, in a healthy person not on anticoagulants, this is a mildly beneficial cardiovascular effect. But if you're already on a prescription blood thinner that is doing exactly the same thing, you're stacking 2 agents with the same mechanism. Your blood's ability to clot becomes doubly suppressed. Garlic, particularly garlic extract supplements, not just cooking with garlic, has a similar effect. Allicin and related compounds in concentrated garlic supplements have demonstrated anticoagulant and antiplatelet activity. Again, on their own, interesting for cardiovascular health. Combined with warfarin or Eliquis, the interaction can push your bleeding risk into dangerous territory. I want to talk about what increased bleeding risk actually looks like in practice, because I think sometimes we hear that phrase and it feels abstract. For people over 60, the most common presentations are easy and excessive bruising, prolonged bleeding from minor cuts, and most seriously, gastrointestinal bleeding. You might notice your stool looks darker than normal, or you feel unusually fatigued. GI bleeding is particularly dangerous in older adults because the stomach lining naturally becomes thinner with age, making the tissue more vulnerable. And because GI bleeding often happens internally, it can become severe before a person even realizes something is wrong. Fish oil at high doses, typically above 3 grams per day, is where the interaction risk becomes most clinically significant. Lower doses may be acceptable, but this is something to discuss with your doctor, not to decide on your own. The practical framework here is not complicated. Every single supplement you take, Every capsule, every powder, every herbal tablet needs to be disclosed to your prescribing physician and your pharmacist. I recommend patients actually bring a bag of their supplements to appointments, every single one, because the drug-supplement interaction database is large and complex, and your doctor and pharmacist can only help you if they know what you're taking. Do not assume that because a supplement is sold over the counter, it's safe to combine with anticoagulants. That assumption puts you at real risk. Food number 4, alcohol. The last item on our list is alcohol, and I want to approach this one thoughtfully because I know that for many adults over 60, a glass of wine with dinner or a drink at a social gathering is a meaningful part of life. I'm not here to lecture. I'm here to make sure you understand a specific pharmacological interaction, and then you can make an informed decision. Alcohol and blood thinners interact in a way that is more complicated than most people realize, because the interaction is different depending on how much you drink and how often. Let me explain both sides of this. Occasional or acute alcohol use, say a couple of drinks at a holiday dinner, tends to inhibit the liver enzymes that metabolize warfarin. The result is that warfarin isn't cleared from your system at the normal rate. Blood levels rise. The anticoagulant effect is amplified. Your INR goes up. Bleeding risk increases. Chronic alcohol use, drinking 1 to 2 or more drinks daily, consistently, has the opposite effect on enzyme activity over time. Chronic alcohol exposure actually induces or speeds up those same enzymes. Now warfarin gets cleared faster than intended. Blood levels drop. The medication becomes less effective. The result is a clotting risk instead of a bleeding risk. So here's the clinical picture. Occasional heavy drinking pushes you toward bleeding. Regular daily drinking pushes you toward clotting. And fluctuating between those patterns, drinking more some weeks, less others, creates unpredictable swings in medication effectiveness that are very difficult for your doctor to manage. There's an additional factor that matters specifically for you. After age 60, alcohol metabolism slows down. Your liver processes alcohol more slowly than it did at 40. Your body composition has also changed, typically a higher percentage of body fat and lower percentage of body water compared to earlier in life. Because alcohol distributes in body water, a given amount of alcohol reaches higher concentrations in the blood in older adults. This means that even what you might consider a modest amount of alcohol has a more pronounced and longer-lasting effect on your system, and therefore on your medication levels compared to when you were younger. And one more layer, if you're taking any over-the-counter pain relievers alongside your blood thinner, ibuprofen, naproxen, or even aspirin in higher doses, adding alcohol to that combination significantly elevates your risk of gastrointestinal bleeding. This combination is one I take very seriously in older patients. I want to be clear, I'm not telling every patient to never have a glass of wine. That's not a realistic or compassionate position, and it's not what this conversation is about. What I am telling you is this. Even 1 to 2 drinks daily can destabilize your INR in ways that are hard to predict and hard to manage. Before you establish any regular pattern of alcohol intake while on blood thinners, have a direct conversation with your physician. Ask them specifically, given my medication and my current labs, what level of alcohol, if any, is safe for me? That's an important question, and you deserve an honest, individualized answer. Alright, we've covered a lot of ground, and I want to make sure you leave this video with something actionable, not just a list of things to be afraid of. Here are 4 practical rules that will help you eat well and stay safe on blood thinners. Rule number 1, the consistency rule for vitamin K. If you're on warfarin, Do not try to eliminate leafy greens. Instead, choose a realistic weekly intake that you can maintain consistently and stick to it. Your doctor will calibrate your dose around your baseline. Dramatic swings in vitamin K intake are more dangerous than a stable, moderate amount. Rule number 2. Replace grapefruit, don't just reduce it. While you're on blood thinners, remove grapefruit and grapefruit juice from your routine entirely. Replace your morning citrus with orange juice, which does not carry the CYP3A4 blocking effect. This is a simple, low-friction substitution that removes a meaningful risk. Rule number 3. The supplement bag habit. Before your next physician appointment, gather every supplement you take and bring them in a bag. Every capsule, tablet, powder, and herbal product. Ask your doctor and pharmacist to review the list against your current medications. Make this a standing habit. Every annual visit, update the list. Rule number 4. Have the alcohol conversation. If alcohol is part of your life, don't assume a small amount is fine just because you've been drinking the same way for years. Your medication, your age, and your liver function all change that equation. Schedule a specific 5-minute conversation with your doctor about alcohol and your blood thinner. Get clear guidance you can follow with confidence. And for what to actively eat, foods that are heart supportive and safe for blood thinner users, think oatmeal, berries, olive oil, lean proteins like chicken and fish in moderate portions, eggs, and sweet potatoes. These are foods that support cardiovascular health without meaningfully disrupting anticoagulant therapy. Let me bring this together for you. You're taking a blood thinner because someone, a physician who cares about your health, determined that the risk of a clot or a stroke was real enough that you needed medication to prevent it. That medication is doing important work. What we talked about today is how to make sure the food on your plate isn't quietly undoing that work or making it dangerously more potent. To recap, number 1, leafy greens. Not the enemy, but consistency is everything if you're on warfarin. Number 2, grapefruit. A daily habit that can silently build up your medication to dangerous levels. Avoid it entirely. Number 3, garlic and fish oil supplements. Natural doesn't mean safe when stacked on top of prescription anticoagulants. Disclose every supplement. Number 4, alcohol. The interaction is complex, age-dependent, and real. Have a specific conversation with your doctor before establishing any regular pattern. You've worked hard to take care of your heart. You show up for appointments, you take your medication, you're watching videos like this one because you want to make informed decisions. Don't let something as fixable as a dietary habit be the thing that creates a complication we could have prevented together. In our next video, we're going to look at natural foods and lifestyle habits that support healthy circulation and cardiovascular health. Approaches that work with your medication, not against it. You're going to want to see that one. If this video gave you something useful, something you didn't know before, I'd ask 2 things of you. Leave a comment below and tell me, did your doctor or pharmacist ever review these interactions with you? I read every comment. And if you found this helpful, share it with someone you care about who is on blood thinners. That share might matter more than you know. Subscribe to Senior Health Review if you haven't already. We're here every week with health information made specifically for adults over 60. I'm Dr. Leonid Kim. Take care of yourself. I'll see you in the next one.